Hey everybody, welcome to this lecture of CyberMD. In this lecture, we will review the different heart sounds and murmurs that you may encounter on the USMLE STEP 1 exam, as well as the anatomical landmarks for the major listening posts. First, let's start with the aortic valve. The aortic valve is located between the left ventricle and the aorta. To hear the aortic valve, you will want to place your stethoscope in the right second intercostal space in the right sternal border. The aortic valve closes at the end of systole, and the sound you will hear is known as the aortic component of the second heart sound, or S2. Murmurs best heard at the aortic valve listening post include aortic stenosis, flow murmurs, and aortic valve sclerosis. Aortic stenosis is a condition in which the aortic valve in the heart, which controls blood flow from the left ventricle into the aorta, becomes narrowed. This can impede blood flow to the rest of the body and put strain on the heart. Aortic stenosis can be treated with medication, lifestyle changes, or surgery to repair or replace the valve. A flow murmur is an abnormal sound heard during a physical examination of the heart. It is caused by the turbulent flow of blood through the heart or blood vessels and is often described as a whooshing or swishing sound. Flow murmurs can be benign or indicative of an underlying cardiovascular condition, such as a heart valve problem or anemia. It is important to note that a flow murmur may be heard even in healthy individuals, and further evaluation is typically needed to determine if there is a cause for concern. Aortic valve sclerosis is a condition in which the aortic valve becomes thickened. In aortic sclerosis, leaflets are typically not restricted in movement, but the condition may lead to aortic stenosis. Next, let's move on to the pulmonic valve. The pulmonic valve is located between the right ventricle and the pulmonary artery. To hear the pulmonic valve, you will want to place your stethoscope in the left second intercostal space in the left sternal border. The pulmonic valve closes at the end of systole, and the sound you will hear is known as the pulmonic component of the second heart sound, or S2. Murmurs best heard at the pulmonic listening post include pulmonic stenosis and atrial septal defect. Flow murmurs may also present loudest at this position as well. Pulmonic stenosis is a condition in which the valve between the right ventricle and the pulmonary arteries becomes narrowed or stenotic, which can restrict blood flow from the right ventricle to the lungs. An atrial septal defect, or an ASD, is a congenital heart defect in which there is a hole in the septum that separates the two upper chambers, the atria, of the heart. This hole allows blood to flow between the atria, causing the blood to mix and potentially leading to increased blood flow to the lungs. Again, a flow murmur is an abnormal sound heard during a physical examination of the heart. It is caused by the turbulent flow of blood through the heart or blood vessels and is often described as a whooshing or swishing sound. The left sternal border is a hearing post located between the pulmonic and tricuspid hearing posts. At this point, hypertrophic cardiomyopathy, aortic regurgitation, and pulmonic regurgitation may be heard best. Hypertrophic cardiomyopathy is a condition in which the heart muscle becomes thickened, making it harder for the heart to pump blood. Aortic regurgitation is a medical condition in which the blood leaks backwards through the aortic valve of the heart. This means that instead of flowing in one direction through the valve, some of the blood flows in the opposite direction. This can cause a strain on the heart, leading to an enlarged heart, heart failure, and other complications over time. Pulmonic regurgitation is a condition in which the blood flows backward through the pulmonic valve, located between the right ventricle and the pulmonary artery during ventricular diastole. This can cause increased pressure in the right ventricle and may lead to heart failure if left untreated. The tricuspid valve is located between the right atrium and the right ventricle. To hear the tricuspid valve, you will want to place your stethoscope in the fourth intercostal space in the left sternal border. The tricuspid valve closes at the beginning of systole, and the sound you will hear is known as the first heart sound, or S1. Murmurs that are most prominent at the tricuspid valve auscultation post are tricuspid regurgitation, ventricular septal defect, and tricuspid stenosis. Tricuspid regurgitation is a condition in which the tricuspid valve in the heart does not close properly, causing blood to flow backward into the right atrium. A ventricular septal defect, or VSD, is a hole in the wall between the lower chambers, or the ventricles, of the heart. This hole allows blood to flow from the left ventricle to the right ventricle, instead of flowing to the body as it should. This can cause the heart and lungs to work harder than normal, leading to symptoms such as rapid breathing, poor growth, or fatigue. Tricuspid stenosis is a condition in which the tricuspid valve, which is located between the right atrium and the right ventricle, becomes narrowed, making it difficult for blood to flow into the right ventricle during diastole. This leads to increased pressure in the right atrium and eventually right atrial enlargement. Lastly, the mitral valve is located between the left atrium and the left ventricle. To hear the mitral valve, you will want to place your stethoscope in the fifth intercostal space in the mid-clavicular line. The mitral valve closes at the beginning of systole, and the sound it creates contributes to the first heart sound, or S1. At this auscultation point, the loudest murmurs are often mitral regurgitation, mitral valve prolapse, and mitral stenosis. Mitral regurgitation is a condition in which the mitral valve, which is located between the left atrium and left ventricle, does not close properly, causing blood to flow back into the left atrium during systole. Mitral valve prolapse is a condition in which the mitral valve bulges into the left atrium during systole. The murmur is usually mid-systolic and is often accompanied by a clicking sound. Following this click, there may be a crescendo murmur to S2. Mitral stenosis is a condition in which the mitral valve, which is located between the left atrium and the left ventricle, becomes narrowed, making it difficult for blood to flow into the left ventricle during diastole. This leads to increased pressure in the left atrium and eventually left atrial enlargement. In closing, knowing what murmurs are heard best at each location can be extremely useful both in the clinic as well as on your exam, as this knowledge may provide a great clue as to the patient's condition. If you are having trouble remembering the order of the listening posts, the mnemonic device Apartment M is often used, in which apartment is abbreviated APT followed by the letter M, where A stands for aortic, P for pulmonic, T for tricuspid, and M for mitral. Thanks for tuning in, and don't forget to subscribe to our content.